Hello, my name is Jason, and I'm here to show you a 10-minute nursing assessment. Every nursing assessment needs to start with you knocking on the door, washing your hands, and introducing yourself. Hello, my name is Jason. I'm your student nurse for today. What's your name?
Sylvia Brown.
Okay. We're going to go ahead, and the first test would be orientation times 4, and that's her name. You want to go ahead and check the wristband to make sure that you're assessing the right person. And then when you go ahead and chart, you are charting at the right person. And then what's your date of birth?
April 2nd, 75.
Okay. And where are you?
I'm in the hospital.
And why?
I had some pain in my stomach yesterday.
Okay. So the patient is oriented times 4. Since she did mention pain, you would want to, the fifth vital sign is pain, 0 to 10. What would your pain level be?
I'm not in any pain right now. I had pain medication.
Okay.
Yeah.
If the patient did experience some pain, you'd want to note the severity, if it's dull, aching, if it radiates, and if there's any eliminating factors like heat or movement or anything like that. And then the time. You would ask when the pain came on and if it's intermediate or constant. So now we're going to go ahead, and every nursing assessment starts with vital signs. We're going to go ahead and get her blood pressure, her temperature, her pulse ox, and her respirations. You can do all these tests at once. A normal blood pressure is 120/80. Go ahead. When you pick a site, you're going to want to do the left arm, but you want to take note if there's any IVs, any shunts. Normal temperature is 98.6. And then we'll go ahead and do her pulse ox. For pulse ox, normal range is 95 to 100, and you're going to want to do it on the opposite arm of the blood pressure. You want to show the patient the readings. If the pulse ox is lower than 95, you want to see if there's a doctor's order for oxygen. Hers is 97, so that's within normal. And her temperature is normal, 98.6. And her blood pressure is 110/70. And then you want to ask the patient, is that your normal blood pressure?
Yeah.
Okay, because that is a little low, 110/70. So now that vitals are done, we'll want to go ahead and start the nursing assessment. It's going to start with a head to toe. You want to start with the head. If she's a fall victim, you're going to go ahead and check if there's any deformities, any swelling. Do you have any pain?
No.
Okay. You want to be careful if there is any swelling. That can be extremely painful. You want to go ahead and take a look at the ears, see if there's any drainage from the ears. If she did have a head injury, there could be some blood. Good, no drainage. And you're just going to want to go ahead and move down and check her eyes for Perla. Perla is pupils equal, round, reactive to light, and accommodation.
To assess direct pupil response to light, shine the pin light in one eye and observe the response of the pupil in the eye. Remove the light, allowing the pupil to dilate back to normal. Then shine the light into the same eye a second time, while observing the pupil in the opposite eye. It should constrict at the same time rate and to the same size as the first pupil. Next, when you assess for the accommodation response, hold your finger in front of the patient's face and ask the patient to focus on the finger as it moves slowly. Increase the distance between the patient's face patient's nose. The normal pupil should hold conscious when patients see the close up.
Very good. So this patient does have normal. You want to chart it as normal corolla. So next you want to go ahead and move down to the nose. You want to note if there's any mucus or drainage or blood coming from the nose. You want to note the amount, the color, if it is yellow or green or clear. Yellow and green could be due to infection. You want to go ahead and check the mouth, check the tonsils. You say ah, see if they're swollen. You want to go ahead and check the tongue and the lips to see if they're nice and moist. If they're dry and cracked, that could be most likely dehydration. You want to check the condition of the gums to see if they're bleeding. And this is a good time to note if the patient might need some oral care. I can get you some mouthwash, oral swabs. Would you like to brush your teeth?
No, I'm okay. Thank you.
Okay. You want to go ahead and follow down, feel her tonsils, see if they're swollen, see if she has any distended veins. Distended veins is a sign of right-sided heart failure. And we're going to want to go ahead and go down and start auscultating heart sounds. And then we're just looking for normal S1, S2 heart sounds.
The first heart sound is S1 or systolic sound. After the S1, there is a second heart sound, S2. S2 is shorter and higher pitched than the S1. Take the pulse for a full minute. Note the rate and also compare the length of the intervals between heartbeats. If they are regularly or evenly spaced, the rhythm is regular. If the strength of sounds are heard clearly and distinctly, you can document the episode or distance. If you hear extra heart sounds, they may be due to a murmur, S3 or 4.
She does have regular heart sounds, so you chart that as regular S1 and S2. You're going to want to do it under the robe, so clothes don't interfere with the sounds. And that's also true with the lungs. We're going to check anterior and posterior. There are 10 places that you want to auscultate bilaterally, and the motion is like this. Checking right to left, down, right to left, down. And then there's 10 spots that make a J pattern, anterior and posteriorly. So after you do that, you're going to want to have the patient turn and also do it to the back. And this is a good time to check the condition of the skin, see if there's any DQ ulcers down at the coccyx. Check the condition of the back of the thighs, posterior section of the calves. Everything looks good. Definitely make note of the heels. That's where a common DQ ulcer can form. So then you want to go ahead and you want to instruct the patient, every time I move my stethoscope, take a deep breath. Good. You just want to go ahead and in the same pattern, check bilaterally, make sure that lung sounds are equal. You're going to want to take note if there's crackles, wheezes, striders, rails, any abnormality. Go ahead and make a note. Next up, we're done with the heart and lungs. We want to go and check for bowel sounds. We're only uncovering the part of the patient that we're working on. So to check for bowel sounds, you're going to want to go ahead and make a cross in the abdominals. This is 4 quadrants. And we're going to want to check, also take each quadrant. And we're noting for hypo, active, hyper, or absent. If the bowel sounds are absent, you need to check for 3 minutes before you chart them as being absent. So she does have nice active bowel sounds. Then we're going to go ahead and check the abdominal. Another test is for distension. You can go ahead and sit down and take a look and make sure that the belly isn't distended. A distended belly will be firm and raised. and probably a little painful to palpation. Next, you're going to want to palpate all 4 quadrants and ask if the patient has any pain.
No, no pain.
Yeah.
No.
Mhm.
No.
So you would chart that as active vowel sounds in all 4 quadrants. And next, before we move on, we're going to go ahead and there's 5 tests that you can check with the hands. You go through the guardrail. It's easiest if these are down and then the bed is raised fully. So next we're going to check for radial pulses, and this is a neurological test to make sure that they're equal on both sides. If they're strong and regular. Very good. Next we're going to check cap refill. That checks the circulation. It's very simple. We're just going to push against the nail bed. And it should turn white and then immediately turn rosy pink less than 3 seconds. Very good. Next we're going to go ahead and check some strength tests to make sure that they're equal. Go ahead and squeeze my hand. Good. We're going to note the strength. It could be 1 to 5. If they are equal, go ahead and push. Another strength test. Good. Nice and strong. Good. Yeah, good. Next, since we're here at the hand, we can check for tenting. It's an easy test for dehydration. You just pinch the skin. And it should immediately go flat. If it doesn't, if it stays raised, that is a sign of dehydration. So we're going to go ahead and move down, only exposing the part of the patient that we're working on. Just like the top, just like the arms, we're constantly looking at the color of the skin to make sure that there's no scrapes or lesions or bruising. We're noting the color of the skin, the temperature of the skin, if it's cracked, cool, clammy, any abnormalities of the skin. Her skin looks great. We're also going to do that for the legs. We're seeing if there's any hot spots. Next, we're going to check for edema. Simply push down, and her skin pops right back up, so she has 0 edema, 0 pitting edema. Pitting edema is rated 1 to 4. Everything looks good. So, since we worked on the hands, we're going to do similar tests to the feet to make sure that everything is equal. We're going to go ahead and check cap refill. If it comes back less than 3 seconds, we're going to go ahead and do some strength tests. Push down. This is also a Holman test. So you can ask, do you have any pain in your calf when you push down?
No.
If she does, you don't want to massage the area. That's pain is due to emboli or DVT. Next, we're going to do another strength test. Good. Push up. Good. And then again, like we did for her radial pulses, we're going to go ahead and check pedal pulses. Noting if they're strong, regular, equal. And they are. Very good. So before we leave and our assessment's done, you always want to take a mental picture of the room before you leave. If she's on any mechanical equipment like suction or oxygen. If she is on oxygen, you're going to want to make sure that it's at the right liters per minute and the nasal cannula is in the nose. We're going to make sure that her side table is within reach, and if there's anything that makes her comfortable, a book, computer, anything like that. If she is dehydrated and she's on a regular diet, be sure to push fluids and have water close by. The most important is safety, and her call light needs to be within reach, and instruct the patient if you need anything, go ahead and push the call light, because that is their lifeline. You're going to want to make sure that the bed is down and the rails are up for safety. And also an important thing is to ask the patient before you leave, is there anything I can do for you?
No, that's great. Thank you.
Okay. If the patient does have pain, you want to tell the patient that you will check if there's a doctor order for pain medication, and the instructor will be right back with that.
Okay.
Thank you very much. Have a great day.
You too.